Hey everyone, let's talk honestly today. No medical jargon, no scary stats, just a real conversation. If you or someone you care about has been diagnosed with a kidney failure, you are probably hearing a lot of words like dialysis, transplant, living donor, cadaveric donor. And honestly, it can feel overwhelming. So let me clear the confusion today. We are diving into the topic many people are too afraid to ask about: living versus diseased kidney transplant. What is the difference? Which is better? What are the risks? What are the myths? So let's break down together. So first of all, what are we comparing today? A living donor kidney transplants come from someone who is alive, usually a close relative who just wanted to help. A deceased donor kidney, also known as cadaveric kidney transplant, comes from someone who has been declared as a brain dead, often due to an accident or sudden illness, and whose family has chosen to donate his organ. It is an incredible act of generosity. Now, both saves life, but they are not the same. So let's talk about timing. One major advantage of the living donor kidney is something we call it as a preemptive kidney transplant. Now, that is just a fancy way of saying getting the transplant before you even start the dialysis. And let me tell you, that is a huge. Preemptive kidney transplants are linked to better recovery, fewer complication rate, less time in hospital, and a longer life with new kidney. With a living donor, you can plan the surgery, prepare mentally. It is not a rushed operation. It's just like walking into battle fully armed. But with the deceased donor, you usually wait, and sometimes it takes months, sometimes years. Meanwhile, the patient is on dialysis, which takes a toll on the body. Now, let's compare them like they would have two phones. Living donor, almost 95% success rate at 1 year, last about 50 to 20 years, sometimes even longer. Less chances of rejections. Surgery can be scheduled, safer for the patient. Now, coming on to the diseased donor kidney transplant, is still great, about 93% success rate at 1 year, last around 8 to 12 years. Sometimes there is a delay before the kidneys start working. We call it early graft dysfunctions. What we call delayed graft dysfunctions. Sometimes the kidneys stop functioning or producing urine immediately after the surgery. And most of the time, you don't get it to plan it. The call comes suddenly. We have a kidney. Are you ready? Now, let's address some myth. People often say, I don't want a kidney from someone who is dead. It won't work properly. It is not true. These kidneys are tested thoroughly. Many donors are young, healthy people who have an accident. Their organs are healthy and strong. Now, another myth is living donor kidney is always better, no matter what. It is not necessarily. Sometimes a diseased donor kidney from a well-matched donor can work just as well, especially with today medical advance. And here is a big one. The cadaveric kidney transplant means you will be waiting forever. Yes, wait time can be long on a cadaveric kidney transplant, but if you register early, maintain your health, and keep regular follow-up, many patients receive kidney much sooner than expected. So we have a transplant waiting list. I have seen lives transformed by both living kidney transplant as well as deceased donor kidney transplants. Mothers going back to playing with the kids, students returning to the college, sons giving kidneys to their father, and complete stranger saving lives quietly, courageously. Both paths are beautiful, both are valid, and both need more awareness as far as the patients and their family members are concerned. If you are watching this today and are on dialysis or waiting for a kidney transplant, please know this: you are not alone. You have options, multiple options. Ask your doctor early, talk to your families, explore living donations, register for the disease donor list, and the earlier you act, the better your chance, and you would ever thought about becoming an organ donor. Please do it. One organ can save up to 8 lives. It is one of the most powerful legacies you can leave behind once you are gone. Let's fight kidney failure, not with the fear, but with the knowledge, love, and commitment. Thanks.